A breast cancer diagnosis is devastating, but what if I told you the most advanced cancer-fighting tool is being used right now in Sioux Falls? In tonight's Avera Medical Minute, Jake Iverson shows us how doctors at Avera are revolutionizing breast cancer treatments. A warning here, some of the video in this story may be hard for some viewers to watch.
No, it's not an arcade. These are the sounds of the operating room. But the technology in this OR is far more exciting than any video game. This is IOERT.
IOERT stands for intraoperative electron radiation therapy. So basically it's the delivery of a specific type of radiation, electron therapy, in the operating room.
In this case, it's Grace Gertis, whose battle with breast cancer started just 3 months ago.
Shocked, very shocked. And I thought, well, there are many others just like me, so I may as well just go right along with it.
Grace's doctor is Juliann Reiland, the woman responsible for bringing IOERT to Avera. With it, women have more treatment options for breast cancer.
I was having a lot of patients who were opting to have mastectomy instead of lumpectomy because they lived too far away and they didn't want to do 6 weeks of radiation. And when you do lumpectomy, you have to do the radiation, so they would say, forget it, I'll just do mastectomy.
The technology is one of a kind, allowing the surgeon and radiation oncologist to work in tandem. First, the lump is removed. Then a beam is positioned to give Grace a boost of radiation to kill cancer at the root. Once in place, the OR is cleared and radiation delivered.
This is 5 times, what's a normal daily dose, if you will.
This radiation dosage is high, but extremely focused to limit exposure to other tissues. By combining treatments, IOERT helps save time, but it also calms the patient's fears.
When you realize that in the operating room, I've just removed the cancer and now I bring in a source of radiation, there's no doubt where that cancer was, and there's no doubt that I'm treating the appropriate place.
Like a typical lumpectomy, post-surgery radiation treatments are still needed, but the amount, it's cut in half.
6 weeks to 3 weeks. So I took the 3 weeks.
Grace is one of 60 women who have been treated through Avera's program, which is one of a mere handful in the United States. IOERT is still considered experimental, but the world is watching every case very closely.
Not only do we cross our T's and dot our I's here, but then that's also checked again in Austria, so we are part of an international study.
Grace was the ideal patient for the study, over 60 and has a well-behaved tumor. Getting experimental treatment can be a scary thought, but Grace had faith in Avera's team of cutting-edge physicians.
I just knew that I was in the hands of good people, and I just trusted in them, and so it didn't really bother me at all.
As cancer-fighting technology improves, Avera will always move to what's most efficient and most effective. And if you ask these doctors, that's IOERT.
At some point in the future, intraoperative radiation for breast cancer will become accepted, standard, and an expectation of women.
With your Avera Medical Minute, I'm Jake Iverson, KSFY News.
With the success of IOERT in breast cancer, Dr. Simon says the technology will also be applied to other cancers in the future.